Okay, so in this video we're going to be doing a quadricep drape. Okay, so the first thing we need to consider is client comfort. So previously we had our client in prone when we were doing the drape for the calves and the hamstrings, and we had the bolster underneath the ankles. But now that we've moved them onto their back, so they're in supine, we want to make sure that we move the bolster to provide client comfort. Okay, so a really important thing to consider there. So if you can see here, we've got a little bit of gap underneath the knees, so that's where we're going to put our bolster just to support that joint. Okay, so Fiona, if you want to lift up your legs for me there, okay, and just relax. Now what that does is when we move on to our massage, when we start applying our techniques in a bit of a downward pressure, we are going to avoid pushing our client into that hyperextension. Okay, so the next thing that you could do if you wanted to and had another bolster is you could place that underneath the head, because in the couches we have a head hold for when our client is in prone, but in supine it can be a bit uncomfortable if their head is placed in and around that area. So you can shuffle them up and rest their head against the place above the hole, or you could use a bolster underneath. Okay, so if you just lay back for me there, Fiona, is that comfortable?
Yeah.
Yeah. Okay. So then we move on to our drape. Okay, so in terms of the quadricep draping, it's very similar to the hamstring drape. Going to be using our big towel, and we're going to again cover the limb in this diagonal fashion. Okay, we want to bring the top of the towel round into a bit of a right angle in line with the shorts. Okay, now we also want to make sure that there's enough towel at the top to cover the trunk area as well, to protect their modesty and just for a bit of comfort and warmth. Okay, so we get the towel in line with the right angle. Make sure you use minimal towel, because again, if you use too much, it'll be hard to tuck and roll into the shorts, but it also will come undone and just look a bit messy and unprofessional. Okay, so when we're here, again, similar to the hamstrings, we want to make sure that our hands are anterior to the thigh and lateral to the thigh. We want to avoid tucking towards that midline. Okay, so grab the towel and the shorts, and then we're going to tuck, and don't forget to roll to expose the treatment area. Right, so this is the video for draping for the lower limb, specifically the calf complex. Okay, so the first thing we need to consider is client comfort. So to do this draping technique, we're going to have our client in prone with their face in the hole of the hydraulic plinth. Okay, then we're going to think about using the bolster. So here we want to place the bolster underneath the ankle. So just lift up for me there, Fiona. Yeah. Okay, just to support this joint here, because ideally once we finish the draping, we're going to be applying massage, and we don't want to force the foot into excessive plantar flexion when we're applying efforage or petrissage techniques and downwards pressure. Okay, so if we're treating both calves, what we can do with our draping is cover the full lower limb and then just fold back the towel to expose both calf complexes. Okay. Otherwise, if we were just treating one calf complex, for example, you might want to cover the lower limb, okay, expose, either fold back the towel or pull it across, okay, to expose the one leg, and then use your other towel to go horizontally across the patient to cover the hamstrings and any other areas that are exposed, and then that way you just have the area that you're treating exposed. One other thing to consider when treating the calf or draping for the calf is you want to expose your treatment area. So here we might be treating gastroc and soleus, and we know that the insertion point for those is on the calcaneus. Okay, so here Fion's got quite short socks on, some people might wear taller socks. We just want to make sure that those are rolled down to expose the full extent of the muscle that we'll be treating. Okay, so in this video we're going to be doing draping for the hamstrings. So first thing you want to do is consider client comfort. So we're going to have our client in prone for this with a bolster under the ankles just to support that joint. Then we're going to be using our big towel. I'm going to cover the lower limb in a sort of diagonal fashion. Okay, so we're covering the one limb there, and then we're using the top of the towel in a sort of right angle fashion in line with the shorts. Okay, so one of the common errors here that students tend to demonstrate is they use too much towel to tuck and roll into the shorts, which means that actually it makes it quite hard to tuck and roll, but also when you start treating, it comes undone and can get in the way. So you just want to use the sort of edge of the towel in line with the shorts. The other common error is tucking towards the midline, okay? So we don't want to tuck any of the towel towards the midline just because it's not appropriate. So here, in terms of our handling, we want to have one hand on the posterior thigh, one hand on the lateral thigh. We're going to grab the towel and the shorts at the same time, and we're going to tuck and roll the towel in one sweeping motion. If you find that there's a bit of towel in the way here, you can always come and tuck the towel underneath the opposite leg just to move it out the way, okay? Then in terms of the height of the towel, remember that the hamstrings originate from the ischial tuberosity, so that sitting bone. So ideally we want to drape up until that point. Now you might want to explain to your client that that's where you'll be draping to, and just use layman terms to explain that to them. Okay, so in this video we're going to be doing a draping technique for the medial thigh. So potentially if we wanted to treat the adductors, for example, we could use this draping technique to expose that area. Okay, so the first thing that we want to do, again, think about client comfort and also what's going to be the best setting for us to execute this draping technique. So for this one, our client's going to be turning. So here we can actually remove the bolster from under the ankles. Okay, the next part of the draping technique is starting with a hamstring drape. Now this is relevant for both the medial and lateral thighs. Step one is always going to be to start with a hamstring drape. Okay, so cover both the limbs again in a bit of a diagonal fashion, exposing the limb that you want to work on. Okay, then you're going to bring the towel around in a bit of a right angle. Okay, and we're going to tuck and roll using our hand only on the posterior thigh and the lateral thigh, grabbing the shorts, tucking and rolling to expose the ischial tuberosity, and then avoiding tucking towards the midline. Okay, once we're happy that the hamstring drape is secure, then we can move on to the next stage. I'm going to get my smaller towel, and I'm going to use this now across the torso, okay? So you're going to lie it down horizontally across your client's torso, making sure that it doesn't cover the draping that you've already done, okay? So you can just move it up to make sure it's in line with the highest point of your hamstring drape. Then the second thing that you need to consider is the way that your client is going to turn, okay? So if I'm treating the medial thigh or the adductors, I need it facing up, okay? So in order for that to happen, I'm going to be getting Fionn to turn to face me so that my treatment area is facing up so that I can treat from over the top. Okay, with that in mind, when Fionn is going to turn and face me, the towel is going to lift up. So I need to make sure that the longer part of the towel is on this side so that when Fionn turns, the towel doesn't then fall off the bed. Okay, so now we want to get our client to turn to face us and to bring their knee up towards their chest, okay? When they do this, we're going to pin the towel to the back of the leg and move with them as they bring their knee into flexion. What this does is it moves the towel out the way of the medial thigh, but it also helps to keep this sort of mid area draped and covered, okay? So to protect the dignity of the client. Okay, so Fionn, when you're ready, do you want to turn towards me and just bring this knee up towards your chest, and I'm just going to guide it there with you. Okay, when you're ready, that's it, bring your knee up. Brilliant, okay? Now, if my client hasn't fully rotated, okay, they might be facing more of a prone position, which means that if I start treating, I'm going to be treating the hamstrings, okay? So you want to make sure that your client is fully turned, okay, to make sure that this hip is underneath. So if you just want to turn a little bit more for me, that's it. Now another thing you can do is you can potentially place a bolster underneath the knee just for a bit of client comfort, if that feels a little bit better for them as well. Okay, how's that feel?
Yeah,
good. Okay, in this video we're going to be doing draping for the lateral thigh. So potentially if we wanted to treat, let's say, the lower portions of glute med and min, or potentially TFL as well, okay? So for this one, again, our client is in prone initially, but they are going to be turning through the movement.
Is it TFL or is it VL?
TFL. You could do a little bit of VL.
Do you drape high enough to get TFL?
Yeah.
Okay, sorry.
Yeah.
Sorry to interrupt.
No, don't worry. Okay, so in this video we're going to be draping for the lateral thighs. So let's say you wanted to treat the sort of lower portions of glute med and min, potentially TFL, or potentially a little bit of vastus lateralis or biceps femoris posteriorly, okay? Now, for this, our client's going to start in prone. However, they are going to be moving through this draping technique, so we just want to move the bolster so that it doesn't get in the way. Okay, so similar to medial thigh draping, we're going to start with a hamstring drape. That's always step one. Okay, so cover both limbs, okay, in a bit of a diagonal fashion, exposing your treatment limb and then bringing the towel around, making sure that the torso is covered and that you've got a bit of a right angle in line with the shorts, okay? Then we're going to use our hands posteriorly and laterally to the thigh, grabbing the towel and the shorts and tucking and rolling to expose the ischial tuberosity, okay? Remember, we're not going to tuck towards the midline here. Once you're happy that you've done your hamstring draping and that it's secure, you're going to get your little towel and you're going to place it over the torso. Okay, so you're going to use your smaller towel and you're going to place it horizontally over the torso, making sure that you don't cover the hamstring drape that you've just done, okay? And then making sure that the longer part of the towel accounts for how my client is going to roll. For this one, if I wanted to expose the lateral thigh, again, my client needs to roll so that the lateral thigh is facing upwards so that I can treat from the top, okay? So for that to happen, Fionn is going to turn to face towards you, which means that the longer part of the towel needs to be on that side to account for her rolling. Okay, now similar to the medial thigh, we're going to pin the towel to the moving leg. However, now the moving leg is coming to the right hand side, okay? So I'm going to use the towel from the draped leg and I'm going to pin it to the back of the exposed leg. Okay, so Fionn, if you just want to turn and face me, I'm on your right side now, and just bring your knee up towards your chest for me. Okay, so as you can see now, I've draped and protected the modesty of the client in terms of her sort of mid area, but also the towel has accounted for the roll and has covered her torso. And
okay, in this video we're going to just demonstrate draping for the back. So firstly, you're going to use this small towel and then this larger towel to cover draping for the area. So essentially, Fionn, what I'd like you to do is just, if you grab that towel for me and just place it down to the side. How we're going to do this is you're going to turn and face the wall just away from us, and then you're going to, I'm going to place this larger towel up like this so I can't see you getting changed. Yeah. But once I've done this, okay, you can turn round to face the wall, and then from there you can use that towel to place that around you so it opens up at the back. Yeah. Okay, does that make sense?
Yeah, that makes sense.
Yeah, fantastic. So what we'll do then is if I place the towel up here like this. Yeah. Yeah. From there then, Fionn, if I could ask you to remove your top and then place that towel around the front of you so that can open up at the back. And then can you let me know when you've done that? Yeah. Fantastic. So from there, if the towel's on the front of you and it can open up at the back, yeah. If you just lie onto the front of the couch for me, please. And then let me know once you've done that, please. Yeah. Yeah, all good. Fantastic. And then from here, what I'm going to do is I'm going to allow the larger towel over the top of Fionn just here. And then Fionn, if you're okay with me just to tuck this towel into your leggings. Yeah. Is that okay?
Yeah, no problem.
So from here, I'm going to tuck this towel into the leggings like such. Okay, and then from here, with this smaller towel, what I'm going to do is I'm going to tuck and roll this to protect her modesty from the side. So I'm going to do that on one side. And then from the other side, I'm then going to just roll from this side as well. Okay, Fionn, as part of this treatment, for me to be able to treat the back, I'm just going to need to unclip this bra. Are you happy for me to do so, or would you like to do that yourself?
Yeah, no, you can do it.
Okay, fantastic. Thank you very much. Okay, so then that is the back exposed. What I then need to do is grab my lotion. and then I'm ready to treat for the back region.